Hello everyone, welcome to GrowMed. In this video, we will discuss a few important points repeatedly asked in the Fmge exam. If you have not done the subject completely and you don't have time, then no worries. You can just look at these important points, all the points related to these topics. So let's start. The first important question asked is the psoriatic arthritis. Usually a case is asked, clinical case kind of a question is asked. And whenever you see involvement of the skin along with that the joints and the nail, then you need to mark it as a psoriatic arthritis. So these are the features seen in the psoriatic arthritis, and also a image-based question is asked in the radiology. They will give the image of the hands and ask you to make the diagnosis. And on the radiology, you can see the finding of pencil in a cup appearance. Next topic, trichotillomania, also integrated with the psychiatry. It is usually an obstructive compulsive disorder, and questions are asked on its complication. The complication of the trichotillomania is trichobezoar. Then another very important topic is the condyloma acuminata. Image-based question is also asked, and questions are asked on its causative agent. And for the treatment of the condyloma, we use an immunosuppressive drug, imaqimod. Then moving on to varicella, also called as chickenpox, also a very important topic. Questions are asked on the causative agent, which is the varicella zoster, and questions are also asked on the incubation period. Then questions can also be asked as a clinical case, like they will give a rash, vesicular rash and family history, and ask you to make the diagnosis. So next, move on to the measles, also a very important topic asked in correlation with the PSM. Questions are asked on the rash, which kind of rash is seen in the measles, and also oblique spots, which is a pathognomic feature of the measles. Clinical questions are also asked given the history of a fever, a rash, and the presentation of the oblique spot, and ask you to make the diagnosis. Then you need to know about the leprosy, the types of the leprosy, tuberculoid, borderline, then leprotic, and questions are asked, image-based questions are asked, and also questions are asked on the treatment. Chromoblastomycosis, usually image-based questions are asked, and this question is usually integrated with the microbiology. Chromoblastomycosis is also known as verrucous dermatitis. Verrucous means what, and the dermatitis involvement of the skin. So a clinical case can be given along with the history of a forest worker. And on the foot, you can see the multiple warts. These are usually brown in color, and the sclerotic bodies are seen, by which you can make the diagnosis that it is a chromoblastomycosis. Then moving on to the syphilis. Syphilis usually types are asked, the primary syphilis and the secondary syphilis, and the causative organism, and also the features of the syphilis, which kind of features are seen in primary and which kind of features are seen in the secondary. So the next question, herpes zoster. Usually clinical questions are asked, and let's see what finding can be seen in the herpes zoster. This is the classical finding seen in the herpes zoster, multiple painful blisters on erythematous base along a dermatome. Whenever this is given in the question, just mark the answer as herpes zoster. Molluscum contiguousum, usually one-liners are asked, the positive organism, and that is the pox virus. Then image-based question is also asked on the molluscum contiguousum, so you need to know the image also. Now moving on to another very important topic asked in the dermatology, psoriasis. So questions are asked on the signs, features, the name changes. Let's see them. The classical finding of psoriasis is silvery white scaly lesion, and image-based questions are asked. They will give you this white scaly-like lesion and ask you to make the diagnosis. And also the classical sign seen in the psoriasis is the auspich sign. Questions are asked, one-liners are asked mostly. Then the nail changes seen in the psoriasis are the pitting of the nails. So these are the changes seen in the nail, pitting, reaching, tymbal, and the onypholysis, and they can give you these features and ask you to make a diagnosis. Then on histopathological examination, we can see the abscess, microabscess, monorose abscess, and monorose abscess, Kuchok pustule. These are the important findings which we can see in the psoriasis. Also, questions are asked on the type of the psoriasis. Let's see them. So these are the types of the psoriasis. So the lesion seen in the gutted is the raindrop-like lesion, and usually seen in the children, and there is history of post-streptococcal pharyngitis. Okay, then the next time, the pustular, multiple pustules like lesions are seen like this everywhere, and thus it is due to the sudden withdrawal of the steroid. And for the treatment, we will be using aceclidine. Erythrodermic. Usually 90% of the skin is involved in this, and it presents as exfoliated dermatitis. All the skin with a scaly lesion-like thing, and it is being left from the margins. So this kind of features is seen in the erythrodermic. Image-based questions are also asked on this, so you need to look for the images also. And there's another kind of psoriasis seen in the pregnancy. Impetigo herpetiformis, it is the pustular variant which is seen in the pregnancy. And for the treatment, we will be using steroids. So that was the types of the psoriasis. Now moving on, pityriasis also a very important topic. Questions are asked on the types. So questions are asked on the type of the pityriasis, rosea, alba, and vesicular, and there are certain important findings which we can see in them. Like the rosea, we see the color rate of stains. And the lesions feet on the trunk look like a first tree appearance. And the first patch of the pityriasis called as a herald patch. So questions are asked on these, like they'll give a clinical case describing all these features and ask you to make the diagnosis. A Pityriasis alba usually presents with hypopigmented lesions and most commonly seen in children. So the next type, vesicular, caused by Malassezia furfurae. So the topics related to vesicular you need to remember are it looks like a spaghetti in a meatball appearance. Spaghetti in a meatball, and image-based questions are asked, and also the causative organism is also asked. Like in flanos, the next topic, the points you need to remember of this topic are it is an autoimmune condition, and the skin features are like papules, then pustule purple, and pruritic. These are the skin lesions. And in the mucosa, you can see a very significant finding that it will show a lazy or a reticulate pattern. Also, nail changes are seen in the lichen planus. So these are the name changes, pterium, aniconia, and pitting. And the name change pterium asked as a one-liner frequently in the Fmge exam. And also image-based question is asked, so you need to know the images also. And the treatment of this lichen planus is we usually use the steroid. So moving on to the next topic, acne. Questions are asked on the cause. The cause, as we know, that it is a Propylbacterium acne. Then you need to know about the 4 stages of the acne and their treatment. Like in grade 1, you can see the comedones. Then in the grade 2, you can see the papules, pustules. And in the grade 4, you can see the cyst. And based on the findings, we need to do the treatment like using the retinoic acid. Then if we see cyst, then you need to do antibiotics also. Then a one-liner is asked in the acne, that is primary lesion, and the primary lesion of the acne is the comedones. So these are some important points related to the acne. So the next topic, pemphigus, a very, very important topic. Questions are frequently asked on this topic. Pemphigus vulgaris, it is an autoimmune disorder, and you should know that involvement, the pathogenesis, that is TSG1 is involved in the foliaceous, and in the vulgaris TSG3, desmoglein is involved. Then 2 classical signs seen in the pemphigus is the Nikolsky sign. On the immunofluorescence, it shows a sign, the row of tombstone. This is also image-based questions are asked on this. So the next topic, bullous pemphigoid, it is also an autoimmune disorder, and the defect is present in the antigen 1 and 2, and you need to remember this. Questions are asked on the findings and the location, like it is subepidermal and it is a tense bulla. So moving on, erythema multiforme, image-based question is asked. On the image, it looks like a target lesion like this, and the causative organism is the HSV, and it's also associated with certain drugs like sulfonamide. Frequently, questions are asked on this phenomenon. Koebsner isophenomenon seen in which of the following conditions? So let us see the conditions. So this is positive in the psoriasis, lichen planus, vitiligo, and Kaposi sarcoma. In these diseases, you can see this Koebner's isophenomenon. Mycetoma, also frequently asked question. Usually image-based question is asked, and there will be a history of a farmer, then also known as a Mathura foot, and you can see that in this lesion there will be swelling present. Along with the swelling, you can see that there will be redness and sinus. So it is also a must-do topic, mycetoma. So moving on, impetigo. Impetigo is the bacterial skin infection seen in the children, and there are honey-colored crusts seen most commonly in the face, and image-based questions are asked, so you need to know the so you need to know the all points about the impetigo, and also questions are asked on the most common cause, which is the step or age. So these are certain points which you need to remember on the impetigo. Moving on, the woodland blight. Questions are asked on the woodland blight. The color changes. Which organism shows which color changes? Like erythema. Like for example, Cornybacteria mimetism shows a red color, coral red color on the woodland, and there are certain diseases which show color. And there are certain diseases which show color changes on the woodland, and you need to read about those diseases. Moving on, another important topic is the dermatophytes, asked in the correlation with the microbiology. Trichophytes. Dermatophyte means usually they are the ringworms which affect the skin. So the types of the dermatophytes: trichophyton, which will affect the skin, hair, and nail; microsporum, which will affect skin and hair; and epidermophyton, which will affect the skin and the nail. If the causative agent and the treatment. So you need to know the causative agents of them and also the treatment. So moving on, vitiligo also frequently asked. Usually image-based questions are asked. So it is an autoimmune disorders, and usually hypopigmentation of the skin is seen in them. And there are various types of the vitiligo which you need to learn, like the segmental type, then chemical, mucosal, and focal. Pyavandism, it is a rare autosomal dominant condition in which on the forehead you can see a triangular patch, a triangular pattern like hypopigmentation is seen in the forehead. So this was a list of the major topics which you need to cover in the dermatology for the Fmge exam. I hope this video was useful to you. Share it with your friends, like my video, share it with your friends, and also subscribe to my channel. Thank you guys.